any PSA value at 1 nanogram per milliliter or less reduces the likelihood of having prostate cancer close to 0. PSA is the blood test for detecting prostate cancer or determining individual risk for prostate cancer. PSA means prostate-specific antigen and is an enzyme that is naturally produced in the prostate gland. The level of the PSA in a blood test is an excellent tool to test for prostate cancer. Why is this important? Well, prostate cancer is the second most commonly diagnosed cancer in men, and the chances are high that your life will be affected by it. 1 in 8 Caucasian men will be confronted with a diagnosis of prostate cancer sometime during the second half of his life. In men of African descent, the odds are even higher. It is 1 out of 4 men. In Asia, however, it is 1 out of 13 men. The problem with all cancers is that there are no symptoms in the beginning stages. Cancer patients feel perfectly healthy at first, even though there might be subtle and very unspecific signs of prostate cancer. In most men, they will go unnoticed. So, wouldn't it be great to find out with a simple test if there is bad weather ahead and to be given the chance to take precautions? This test is the PSA-test. The earlier a clinical meaningful prostate cancer is detected, the better for the outcome, because in the early stages, prostate cancer is perfectly curable. For this, you will need at least a digital rectal examination and a PSA, taken by the time you turn 50. If you are genetically at risk, you might even want to start at the age of 40 or 45. As a rule, any PSA value at 1 nanogram per milliliter or less reduces the likelihood of having prostate cancer close to 0. Starting somewhere at 1.3 nanograms per milliliter, the risk is rising in an exponential fashion. In lab reports, at least here in Germany, they tell you that everything below 4 nanograms per milliliter is normal, which is not true. And at this point, it gets complicated. And this is why training and experience is needed for prostate cancer diagnostics, because certain circumstances can make the results blurry. It is not a good idea to measure PSA when there is a urinary tract infection, because almost always the prostate is affected as well, with the result of an elevated PSA. After acute prostatitis, it is therefore wise to wait at least for 3 months, better for half a year, before PSA is measured. But much more important is the natural aging process, which very often goes along with an increase in prostate size. This development starts around the age of 40 in most men and is somewhat unpredictable. While some men only get a moderate prostatic enlargement, it seems to explode in others within a very short time frame. This has nothing to do with prostate cancer. The true mechanism behind this hasn't been fully clarified so far. But the important point is this simple equation. More prostate tissue equals higher PSA levels. So depending on the size of the prostate, a PSA of 4 nanograms per milliliter, even 10 nanograms per milliliter might be perfectly acceptable in some men. And I have personally witnessed a case of a man with PSA 18 who didn't have any prostate cancer at all. Age is very important as well. We know from high quality data from Sweden that the average 60-year-old has a PSA around 1 nanogram per milliliter. The implications are these. If you are 60 and your PSA is 1 nanogram per milliliter, you are still not quite off the hook regarding a later diagnosis, but the chances are low and your risk of dying from prostate cancer is very, very low. So, congratulations. I start to get nervous in a 50-year-old with a PSA of 2, whereas I'm very relaxed in the 68-year-old with a PSA of 2. So, what do we need the digital rectal examination for? Luckily, it doesn't happen often, but some cancers cannot be detected by PSA. A PSA of 2 in these men even may equal advanced disease. This is why palpation is needed for not to overlook these cases. Another important point is PSA dynamics. Measuring PSA once is okay, but we want to avoid overdetection of prostate cancer and overdiagnosis. For this reason, it is important to get a feeling for how much PSA rises over time, especially when there is a significantly enlarged prostate. What the heck is overdetection and overdiagnosis? Find out more in this video. Thanks for watching. Bye bye.